You might have noticed yesterday that there were a number of apps presented that were intended to help you manage your health and your wellness. I would suggest that you'd rather be involved with those than this one, so think about that. I'm also in the enviable position of using someone else's slides, so I'm going to do my best here. This is the outline of the talk. I'm going to just explain the goal of this project, the app design, the data transfer from electronic health records to reporting jurisdictions, and then the analytics engine that drives the app. So this is the U.S. standard certificate of death. When a patient dies, there are legal requirements that the attending physician provides information as is contained on this form. There are also sections of the form where the funeral home adds data and so on and so forth. Now, let me explain the reality of public health reporting in the United States. We are the somewhat United States, I guess. There are 57 reporting jurisdictions in this country. Most of those are states, but New York City is a reporting jurisdiction. Territories like Guam are reporting jurisdictions. And every one of those reporting jurisdictions has their own system in place for what to do with this and other public health data. And those systems vary from paper to FTP and CSV files, CVS files, to electronic reporting systems. And there's absolutely no standardization of anything. So the overriding goal of the work Georgia Tech has been doing with the CDC is proof of concept applications to try to move the entire public health surveillance infrastructure of the country to a standard of electronic FHIR-based technology. We're certainly not there, but we're making progress. So our goal in this project was to define a new FHIR app a set of new profiles in FHIR for common national death reporting, a demonstration app showing what could be done, and maybe the most interesting part of the project, an analytics engine to provide, I don't know if the term clinical decision support is relevant at this point in patient care, but decision support. And I'm going to explain all of that as we progress. So the architecture of the app was as follows. The presumption is that we have a FHIR-enabled EHR. We simulated that in this project that can support a Smart on FHIR app, which would ultimately report the death certificate information as a FHIR document bundle to a state health department. And of course, there are no state health departments that could currently receive such a bundle, but we're hoping to work toward that. And that the app is supported by an advanced analytics engine that actually guides the physician in providing the optimal information. I'll explain what all that means as we proceed. And I think I don't like automated slides. I've basically explained all that. The only part of this that isn't yet implemented in at least working prototype form is the actual electronic reporting of the FHIR bundle to some hypothetical reporting agency. I should say that this has been presented to many of the state authorities, and there are at least 2 states that are quite interested in this project. And I'm somewhat optimistic that at some point in the not terribly distant future, we're actually going to be able to demonstrate this electronic reporting. We may need the assistance of some of the companies that have been presenting the last day or two to FHIR enable some legacy system that isn't FHIR enabled. So here's the interesting stuff. This is the app interface. This slide says design, but I'm going to show you an actual working version of this thing if that part of the presentation actually works. I'm always particularly after visiting with Michigan a year or so. I'm very leery of doing live demonstrations. So what you see here, I wish I could point, but is in the middle of this is a scaled timeline. It's a logarithmic timeline of the clinical events that the app believes, based on the analytic engine, is the sequence of events that led up to this patient's death. So we've gone in and we've abstracted the necessary data from the patient's EMR. We've sent that data to an analytic engine that was developed at Georgia Tech, and more about that toward the end. And it's given us back the information to create this timeline. Now imagine a physician doing that. It just doesn't happen. It takes too much time. And in fact, in a teaching hospital situation, I've been there, done this. You're called in the middle of the night to see a patient who has died, and that's the first time you've ever seen this patient. And yet you're supposed to magically provide the optimal information to this critical public health surveillance need. So that's where the analytic engine comes in. The orange are actual alternate sequences of events. The red dots are the critical clinical events, and the three orange lines are three alternative possible sequences of events. If the physician picks one, then those red events have the little circles above them, so the physician can see visually which events in the total sequence of events are incorporated into this, this particular sequence. In the lower left there is the same information presented as it would normally be written on a paper form. And of great interest in public health is a button below that called Validate and Submit, which if there was something capable of receiving this would do the whole process electronically. So that's the idea. Now I'm going to, in theory, show this to you. Nope, it didn't work. Oh, I guess I'm supposed to click on this. That's right. So here you see the physician signing in. Here we're choosing a patient, and we're pretending that the death reporting app is in this app gallery, which it isn't yet. And there is the Smart FHIR launch parameters have given the app what it needs to know about the patient. The app has rupture of the heart. That will kill you every time. The app has created this longitudinal sequence of events which the physician can expand or contract. The physician can pick whichever sequence they think best represents this patient. And you can see that the information is presented below in text, as I said it would be. So it's very simple, which it, of course, has to be if it's actually going to be used. So how do we then transfer this data to the state reporting jurisdictions? We believe there need to be FHIR profiles developed to represent this information, which involves a series of things that turn out to be relatively easy to map into existing FHIR resources and things that are not so easy to map. We're working on that. Our priorities are to use FHIR as it is as much as possible, to use public profiles as much as possible, and to develop new profiles and or FHIR extensions only when absolutely necessary. We're back to where we started. Here's an example of a section of the death reporting certificate that very easily maps to FHIR resources. This is the demographic data. This is the patient resource. related person resource, location resource, practitioner resource. And here's an example of the clinical data that the CDC wants about the patient and their medical history that doesn't map quite so easily. There can be many practitioners. We think this other stuff about tobacco use and manner of death and stuff might best be represented in a questionnaire response, or perhaps observation resources, but it's not a, I'm going to get done early, Wayne. I'm not going to have people yelling at me because they're hungry. So as you can see, we're putting a lot of time and effort and thought into this mapping. Anyone who wants to see the details, these slides are going to be available. Now the analytics engine. Now, I personally believe that the architecture of a FHIR app connected to an EHR, but also able to access an analytics engine via web services, is going to be a very important architecture. Now, if you think about this application, if we could get through all of the political issues, in theory, you could have a single analytics engine for the entire US that is just continuing to learn and improve based upon the information from every single reported death in the country. There are 20 bazillion other possible analytics engines that could be developed. But in public health, this is the single most important role of public health, is understanding the natural history of disease and why people die. So what we did to create an initial stab at this was we were given a large data set of 2.5 million deaths from the National Vital Statistics System. And Dr. Wang's students, I'll show you their picture at the end of this, mine that for temporal patterns with a high degree of support. And they discovered almost 66,000 rules. So it's those rules that create the orange lines that you saw in the app based on the data that's in the patient's chart. Here's the team. Professor Wang is seated next to the old guy in her lab, me. I'm easily the oldest person at Georgia Tech, I think. I don't know. But that's Professor Wang, who's unfortunately at an NSF meeting today, or May would have been here. She's an amazing presenter. And the gentleman just next to the end with the beard there is Ryan Hoffman, who did this work as part of his PhD thesis. So thank you all.